HIPAA compliance. What is HIPAA? HIPAA stands for Health Insurance Portability and Accountability Act. HIPAA was originally implemented to allow employees to move from one employer to another and be able to receive health care coverage. If you had a pre-existing condition, sometimes the new employer's health coverage would not cover you. Then HIPAA morphed into a bill that protects health information of patients. Compliance includes rules on privacy, security, breach notification, and enforcement with regard to protecting consumer health care information. The focus was always on protecting confidential information. HIPAA requires covered entities to apply appropriate administrative, technical, and physical safeguards to protect the privacy of PHI, protected health information. Privacy and security rules included in HIPAA require covered entities, business associates, physicians' offices, dental practices, pharmacies and electronic health record firms, or health clearing houses to implement policies to secure data, ensure compliance, accountability, limit access to protected health information, conduct workforce training, and safeguard PHI. Covered entities are health plans, healthcare clearinghouses, healthcare providers who electronically transmit any health information. Business associates are any organization or person working in association with or providing services to a covered entity who handles or discloses personal health information, PHI, or personal health records, PHR. You could be surrounded by business associates, so you really need to make sure you understand who they are. This could include attorneys that work with a doctor's office who has access to PHI, IT vendors who have access to PHI, or anyone who stores PHI should be classified as a business associate. Since 1996, HIPAA changed the way organizations create, receive, maintain, and transmit PHI. Efforts to protect United States citizens from data theft and ensure sensitive healthcare information is only revealed to appropriate parties. Originally, HIPAA rules were implemented August in 1996, and then came along the high-tech piece of the legislation, which came in February of 2009, and then the final omnibus rule in January of 2013. So you'll hear the high-tech rule and the omnibus rule. Penalties outlined below are per day and per violation. This means that if you have multiple violations, you could potentially get fined up to $50,000 per day for each violation until the violation is resolved. It is so very important to make sure you follow your policies and procedures to avoid these penalties. Penalties could be, you did not know, $100 to $50,000. Reasonable cause, $1,000 to $50,000. Willful neglect, corrected, $10,000 to $50,000. Willful neglect not corrected, $50,000. So these fines can be very, very steep. You have to protect your organization, so make sure that you follow the rules. HIPAA privacy rule applies to all healthcare providers, and it includes protecting your healthcare information in all forms, whether it's paper, whether it's oral, electronic. It gives patients rights to their own protected health information, access to their records, and disclosure on who else has information about their health records. HIPAA security. Most violations for HIPAA security rules result from businesses not following policies and procedures to ensure the safeguard of EPH, electronic protected health information. People have to make sure that they maintain a safe environment for this protected health information, and this is what the HIPAA security rule is based on. Breach notification is very important that everyone understands that you have to notify when there's been a breach of protected health information within your organization, and certain rules apply to determine whether or not who you have to notify. So if there's more than 500 people associated with this breach, you need to maybe even notify the media. Remediation plan. Every medical office is different, but each must have a remediation plan, and a remediation plan that will help correct errors or deficiencies within your organization. Make sure you're prepared and you have something in place to help you figure out how you can make these things better. The final omnibus rule that we just talked about, one of the main things that it did was it included subcontractors as business associates, because they also had, guess what, access to PHI. So now they must also comply. Well, this has been HIPAA compliance. What is HIPAA? Thank you and have a great